Today I shall talk about the puncture technique, obviously the radial puncture technique. While most of you can puncture the femoral artery without any problem, most likely or most probably with your eyes closed, I would recommend that you should keep your eyes open for radial puncture, preferably both the eyes. And first you want to go ahead to do puncture. The first thing you should ensure that Allen's test is normal or positive. Although many authorities do not recommend Allen's test these days, but I would strongly recommend that you should always perform Allen's test. Allen's test, as you know, is a test for collaterals between radial and ulnar arteries, and it should be positive for radial artery to be used for radial puncture or radial root interventions. The inverse Allen's test is also done, which diagnoses the patency of radial artery, and it is especially useful for repeat radial puncture. So for repeat radial puncture, both Allen's and inverse or reverse Allen's should be normal or positive, and then only you can decide that this radial is suitable for radial root approach. Allen test, as you know, we occlude both the radial and ulnar arteries, try to ask the patient to clench or fist 10 to 15 times. That blanches the palm. We remove the ulnar artery arm or hand and see in how many seconds the normal color returns. If it returns within 7 seconds, it's normal and you can go ahead with the radial technique or radial approach without any problem. If it is more than 15 seconds, then you should do some alternative test, which has been shown in our atlas also, before you proceed for radial technique. Now, for the radial puncture, I think that two things are important. If you hit the artery, try to complete the puncture in that one, because the first prick is the best prick. Repeated pricks will be inducing some spasm, and it will be difficult for you to use that radial artery. Second thing, once you hit the artery, do not bother for an anterior puncture. Just go ahead and counter puncture the artery, and then take out the needle, slowly remove the plastic cannula. This is where I feel that you also need some adjustment if you are a femoral operator. Go slow. Once there is free flow, then you put that wire and the sheath as you do in any other case. So again, this is two important things, and again two important things where when we try to do the actual procedure. First, you must select your site properly, as we have shown that it is 2 to 3 centimeter proximal to the distal radial crease. But wherever the radial artery is well palpable, choose that site. Secondly, you should be able to fix the radial artery properly. You can do with between 2 fingers, or like this, or some people will do between these 2 fingers. But that is important. Go ahead, use the Gelco 20C needle, puncture the artery. Once you get the blood, counter puncture, take out the needle, slowly pull back the cannula till you get a good free flow, put the guide wire and the sheath, and afterwards spasmodic cocktails. At times, you may have to use not the regular site, but the higher puncture site. It is used most commonly in our case from the left radial root, where we want to do or to perform the infradiaphragmatic diagnostic or intervention cases. Secondly, if the radial artery is occluded lower down, you might need to go a bit higher. Suppose you have used the radial artery for some puncture on the same day, and you need to perform another case on the same patient, you may have to go a bit higher. So higher puncture is not difficult, because up to mid-arm the radial artery is palpable, and if you can feel the radial pulse palpable or pulse is palpable, you can always puncture. The only disadvantage is that in hemostasis, in the post-procedure management, you have to be extra careful that you achieve adequate hemostasis. Now, many people have problems. Patient was taken up for radial artery angiography, then was not decided for the angioplasty. We took him out, took the sheath out, and then he became unstable, or he wanted the angioplasty on the same day. What should be done in that cases? Can we use the same radial or not? Yes, you can use if that area is not very tender. You might have to go a bit higher to avoid the previous puncture site. And these are the two things which you should keep in that mind if you are using the same radial on the same day. I think that summarizes the radial puncture technique in brief. Always, as I've told you, it is a bit difficult from femoral, but once you follow these simple instructions, I think within a minute or so, you'll be ready with your radial puncture and you will complete your radial puncture. Thank you.